Hi, if you've joined us now, we're just waiting for a few more people to join. This is the Nottingham and Nottinghamshire CCG vaccination webinar, focusing today on breastfeeding and fertility. Hi everybody, and welcome on behalf of Nottingham and Nottinghamshire CCG to our vaccination webinar on breastfeeding and fertility, focusing today on obviously the COVID-19 vaccinations next slide, please. Today, my name is Jennifer Moss-Langfield. I am a GP and lead on the vaccination programme. I'm joined today by Andrea Ellis, who is the consultant obstetrician and gynaecologist, and Dr. Simon Thornton, who is a consultant gynaecologist and fertility specialist, and Natalie Boxel, who is a specialist midwife feeding and infant feeding specialist. The Nottingham and Nottinghamshire CCG are the commissioners of our healthcare services across Nottingham and Nottinghamshire. Next slide. So a brief outline of this session. We're going to go through some of the impacts on pregnancy and COVID, and we're also then going to go into fertility issues and the relation to the vaccination programme, and then we're going to focus on breastfeeding. If you have any questions at all throughout this, please just add them through in the question and answer function at the bottom of the screen. And what we'll do is we'll have a little look at all of those at the end and go and answer as many as possible. We will live stream this session on the CCG YouTube channel, and then you'll be able to share it through all of our communities and networks. We will answer as many questions as possible, but if there's anything that we can't answer, you can actually email us afterwards, and we'll put a link in at the end, and we'll pull it all together into an FAQ document for sharing afterwards. On this programme, the information has been quite fast changing. The information as of today is accurate, and that today's date is the 29th of July 2021. Thanks. Next slide. I'm going to introduce Andrea Ellis, who is one of our consultant obstetricians and gynecologists from Nottingham University Hospital, who is going to talk us through some of the perils of COVID and pregnancy. Over to you.
Thank you. And welcome to this session. So just to put this in context, at the moment, we're particularly worried about COVID and its impact on our pregnant women. The Delta variant of virus is very highly infectious and it's spreading rapidly. There are no longer the same sort of public health measures in place, with the relaxing of restrictions on the 19th. And so therefore, there is very little to stop the variant passing rapidly through the unvaccinated population. Pregnant women are at increased risk from COVID, particularly at any point during pregnancy, but in particularly in the later part of pregnancy, in the last trimester, after 28 weeks. We know that pregnant women have a higher risk of hospital admission with COVID, high risk of IT intensive care unit admission, relative to non-pregnant women. We also know there's an impact on the baby, up to 3 times the risk of a preterm delivery, and that's why this results in a higher number of babies ending up on our neonatal units. But sadly, it also getting COVID infection during pregnancy is now recognised to double your risk of stillbirth during pregnancy. So it's a very significant risk. And currently, sadly, we are seeing a rise throughout the UK of pregnant women being admitted sick to hospital, to the respiratory units, to intensive cares, and onto our labour ward. So it's very important for women to be vaccinated. And the RCOG and the RCM, that's the Royal College of Obstetricians and Gynecologists, and the Royal College of Midwives, recommend that women should be vaccinated in pregnancy or when breastfeeding as soon as they can be. Have the next slide, please. So women ask me in clinic, how can I reduce the risk? Well, the good news is the social distancing does work, hands, face, fresh air, all the things that we've learned over the last year. It is really important to continue to attend all your antenatal face-to-face appointments that you need. All healthcare facilities follow COVID-safe practices. That's why we still have the restrictions on visiting in place, that we still have everybody wears a mask in a healthcare facility, etc. We do recommend that you and your partner do regular lateral flow testing, which is free and easy to access, twice a week. And particularly it would be good if you did a lateral flow test before attending any sort of appointment at a healthcare facility. If you get symptoms, then obviously you need to attend for a PCR test. And it's very important to tell your midwife, GP and labour ward if you have a positive PCR test for COVID, so that we can look after you better. And as I said before, the best prevention is vaccination, as recommended by the RCOG, RCM and the JCVI for all adults, including pregnancy. Thank you. Can I have the next slide, please? I'll introduce my colleague, Dr. Simon Thornton, who's going to talk about the fertility aspects.
Thank you, Andrea. Can I have the next slide, please? So in the early stages of the vaccination programme, there was quite a lot of anxiety about whether vaccinations might affect a woman's ability to conceive. But fortunately, as we've been accumulating data from around the world, a lot of reassurance can now be applied there. The confounding factor was that for historical reasons, generally vaccination studies don't recruit women who are pregnant, but actually many accidental pregnancies did occur, and also there's quite a big data series from the United States that's been following women who are pregnant, and the data has been very reassuring, and it's quite clear now that the chance of conceiving is unaffected by vaccination, and also the chances of miscarriage are unaffected by vaccination. So we can be very reassured that for women who are planning on getting pregnant, that it's safe to get vaccinated. And as you'll have understood from what Andre's been saying, it really does make a huge difference being vaccinated before pregnancy, because of the added risks that pregnancy has if a woman actually catches COVID during pregnancy. And as Andre said, there's still there are new variants coming along. We've got third wave, so it really is important to get vaccinated before you conceive. So next slide, please. The other question that comes up quite a lot is it sensible to delay either fertility treatment or having or getting pregnant until after both vaccine doses are administered? But the reality is that there's no reason to delay. either the fertility treatment or conceiving naturally to get vaccinated. It's much better to get on and get you can carry on with your fertility treatment, and there's no reason to delay. And it's quite reasonable as well to have one vaccination before pregnancy and one in pregnancy as well. Next slide, please. And I wanted to add a little bit here because about the effect on the menstrual cycle of having a vaccine, because there's been quite a bit on social media about women who are reporting either delay in a period, or maybe a slightly lighter period or a slightly heavier period. So just in terms of the background to this, and to put it into a little bit of context, we know that other common vaccines, such as the flu jab or HPV vaccine, can cause some short-term changes in the menstrual cycle. And it's probably due to the mild fever that is commonly seen after a vaccination. So when the studies are being done to look at the impact of COVID vaccination on menstrual cycle, perhaps not surprisingly, there have been some reports of minor cycle changes shortly after the COVID vaccine. There's a very large UK study, the ZOE study, which is actually following thousands of patients who've been vaccinated. And what they're finding is that about 1 in 200 women report some change in their cycle in the 1 or 2 cycles after having a vaccination. But as with other vaccines, those seem to be limited to just 1 or 2 cycles, and there's certainly no suggestion that that would be associated with any long-term problems. So I wanted to sort of add that in as well. Okay, next slide, please. I'll hand over then to Natalie Boxel, who's a specialist midwife in infant feeding.
Next slide, please. Natalie, are you okay to go with this?
Hi, yeah, sorry, my video's not showing up, but that's fine. So yes, so this is a slide that has been updated with current information around breastfeeding and the COVID vaccine. So if you're currently breastfeeding your baby and considering getting the vaccine, it's really reassuring to know that you don't need to stop giving your baby your own milk to be vaccinated. And that's because there's no known risk associated with it being given to breastfeeding parents. And it's the same as with other women who are considering the vaccine. You can get all 3 licensed vaccines if you're breastfeeding. So one of the main concerns a lot of parents have is how the vaccine will affect their milk and their baby, obviously. But the thing is, there is no vaccine ingredient that can pass through to your baby via your milk. It just can't get through that way. And evidence actually shows that only antibodies pass into your milk. And these are not harmful. They're actually really protective against the virus. So some women have reported anecdotally that post-vaccine, they've had some issues with mastitis and altered milk supply. And if you do experience this sort of thing, the first thing I would want you to do is contact somebody for feeding support, whether that's your midwife, your local GP, health visitor, or a national breastfeeding helpline. And there is no data at the moment on the number of feeding parents, but I believe there are studies undergoing at the moment where milk is being collected and tested in this country. There are loads of reasons to keep feeding your milk to your baby during this pandemic. So there's live constituents in human milk that can't be replicated by formula. And these live constituents, they destroy harmful pathogens and they boost your baby's immune system. And not only does it offer nutrition and comfort for your baby, but it reduces the chance of your baby developing an infectious disease. So if you haven't had the vaccine and you are breastfeeding at the moment and you unfortunately do contract COVID-19, evidence shows that parents need to be kept with their baby day and night. So that means rooming in together and continuing skin to skin and feeding. So you shouldn't have any separation from your baby if you do have suspected or confirmed COVID. And there's no evidence, as I've said, that COVID-19 can be passed through to the baby via breastfeeding as well. Same as the vaccine, COVID-19 doesn't pass through your milk. And there is evidence, however, that mothers with COVID-19 pass their antibodies to COVID through to their baby. So you still need to keep breastfeeding, whether you've had the vaccine or whether you haven't, and if you're breastfeeding. Next slide.
So thank you, Natalie, Simon and Andre. And I just want to add on to Natalie's message. I was a breastfeeding mother when I received my first vaccine there, and I know that it did cause some concern for a lot of women about whether you should do, and it was something that I was very, very glad to be able to give that immunity to my son. So I felt I was lucky to be able to do that, because he obviously is far too young to be able to be vaccinated himself. So all the key messages and information we've gone through. So I'm just going to go through. So everyone who is over 18, this is now the time that you can get vaccinated. You can attend any vaccination centre by just walking in. And if you've actually already had your first dose and want to come in for your second dose, you can just walk in for your second dose as well. You don't need to come on your pre-booked appointment, although you can if you want to come in early. As long as it's after 56 days there, you can come in and get your second dose. And we really want as many people as possible to come and get vaccinated, especially those who are considering pregnancy or are pregnant, because we know that this is an increased risk group. You may have seen lots of different, news about the different variants of COVID-19 circulating. And it's really important that we do respond quickly to this. And I know that there's increased concern about whether the beta variant will come over here. So we want to get the maximum protection from the virus as early as possible. So please come and get vaccinated. If you know anyone who may not be able to access this because of this is in English, we have actually got all the information translated into over 23 languages, widely spread across Nottingham and Nottinghamshire, and it can be found here on this web page, which we'll put in the chat later as well, so you can just click on it. But if you can access it on the Nottingham CCG NHS.uk website, go into the bit on COVID-19 and the vaccination programme, and it's in the flyers and videos section. Next slide, please. So here is the detail about where our vaccination sites are and when they're open. So we have got, so today's the Thursday, so all of our vaccination sites except QMC are open today, and the times are specified on our website. Forest Recreation Ground, we have open 8 till 8 every single day. There's a really good one to go and just get vaccinated at, and all of the others had slightly more, and the same goes actually for the Mansfield Vaccination Centre. The slightly reduced times and all the other ones do vary day to day, but do check on our website and you should be able to get yourself vaccinated. Next slide. So we've got a lot of more information, because we know a lot of you may want to have a little look at things. So we have lots of NHS websites, and this is really good, trusted information. There are a lot of bits of information on the internet, and we want to be able to direct you to stuff that has been properly researched and will give you good informed information. So NHS websites, NHS England and NHS Improvement London have got a really good website on the vaccination and communication materials. Obviously, our government websites have got really good vaccination information, especially focusing on those women of childbearing age, currently pregnant or breastfeeding. And the Royal College of Obstetrics and Gynecologists, RCOG, have got an amazing toolkit on there. And there's a really good webinar that they also did earlier in the year, going through some of those pros and cons of getting vaccinated, and so you can make your informed choice. There's also a British Fertility Society fact sheet, and there's some really good information on the BBC Asian network on COVID and pregnancy, and that's in 5 South Asian languages on the BBC website there. And we, of course, have our social media pages from the CCG. Next slide, please. Now, you may have some questions, and I'm going to hand over now to Katie, who's going to go through the questions that we already have on the chat, and we'll answer them as best as possible. Thanks, Katie.
Thank you. So we've had one submitted via email before the webinar that I'd like to open up to Natalie if possible. It's around breastfeeding. So the question that's come through is, I'd really like to have the vaccine. However, I'm currently quite concerned about having it while breastfeeding. I understand that breastfeeding parents have been advised that it's okay to have it. However, I worry that there will be an unknown side effect to my baby that we're not yet to discover, as was the case with the AstraZeneca vaccine and blood clots.
Yeah, and this is the thing, there's going to be a lot of uncertainty when you're breastfeeding your baby anyway, and you just need to be able to look at the information so you can make an informed choice around it. I think just to reassure you a bit, it is important that there's no evidence to show that any vaccine components are going to pass to your baby through your breast milk. Now, there is research to support that. There was a study this year in California by Golan. What they did was they collected 13 breast milk samples from 7 people after they'd had the vaccine. And these results showed that nothing from the vaccine was detected in the samples. So these results, they back the current recommendation that vaccine-related ingredients are not transferred to your baby, so that if you are going to carry on breastfeeding, you don't need to stop in order to get the vaccine. And also there's recent reports that breastfeeding people who've received the vaccine then also pass antibodies onto their babies, which I've already mentioned, which is really reassuring. And also overall, there is so many benefits to breastfeeding your baby, especially in a pandemic. You know, even if you haven't had the vaccine, you're providing a lot of protection for your baby, but you're going to have that extra layer of protection for your baby if you have the vaccine. So I hope that helps.
Thanks, that's a great answer, Natalie. Does anyone else have anything else to add in on that? I'd like to add that personally, I was breastfeeding when I had my AstraZeneca vaccine there as well, and I'm still happy that I had that decision, made that decision even after all of the information about the blood clots came out. Actually, the risk of that is still really low, and we know that if you've already had your first vaccination with AstraZeneca, we still recommend you have your second vaccination of AstraZeneca as well, which I went on to have after the blood clotting information come out, because actually it's it's an immune reaction rather than actually a blood clotting reaction, and it's an incredibly rare occurrence, and it occurs much more frequently with the first dose than it does with the second dose. And I think that when you balance those risks with the risks of COVID, particularly of blood clotting, because COVID itself, infection, gives you an 8 times increased risk of getting a blood clot, then it really does tip things in favour of getting fully immunised. We know that with the AstraZeneca vaccine, that 1 dose will only give you about 33% coverage. So coming and getting that second dose, which more than doubles your immunity to COVID, is really important. And with both of the vaccines, if you have both vaccines with either Pfizer or AstraZeneca, your chance of going into hospital if you do catch COVID is incredibly small now. I think Andrea wants to come in on this as well.
Yes, I was just saying that the RCOGs, well, they've reported that there's, within a fortnight, over 100 women in the UK were admitted during pregnancy, last fortnight actually, to hospital. It's sick with COVID, but none of them had been double vaccinated, and I think only 5 had 1 dose actually. So it does give you some protection, but obviously if you want to be, if you want to remove that risk entirely, you need to be double vaccinated.
And that's what we're seeing in non-pregnant women as well. The vast majority of the infections locally and nationally are people who have not completed their vaccination program, and most are completely unvaccinated, and some have only one vaccine, and there are only a small number of people who have had both vaccines. And locally, I do know that the people who have had both vaccines and have been admitted into hospital have been significantly unwell with other things as well. So we are seeing that this vaccination program is working. It is preventing people becoming seriously unwell. And we would like to really extend that to as many people as possible, in particular our pregnant women, who are particularly vulnerable, along with their babies if they're delivered early. Do we have any more questions?
Yes, we do. Just to follow up on that one, somebody's put in the questions around, do all these recommendations apply to all vaccines?
So, yes, we do recommend that everyone comes and gets a vaccination. Anyone who's under 40, we're recommending Pfizer or Moderna anyway. And actually, anyone who's pregnant, we're recommending Pfizer or Moderna. But the reason for the pregnancy advice is because we do not have as much information about AstraZeneca in pregnancy as we do with Pfizer and Moderna, simply because we did in America, they only gave Pfizer and Moderna, and they did that a lot earlier, and they didn't have any restrictions on pregnant women getting vaccinated. So when all their healthcare professionals got vaccinated in December, January, February, a lot of pregnant women got vaccinated, and we have a large amount of data on the safety of those vaccines. And so that is the reason behind the preference for Pfizer or Moderna for pregnant women.
Great.
Anyone else want to come in on this one as well?
Jen, can I just add a little bit, because actually working in the vaccine centres, vaccination clinics, I was seeing quite a few women in the early stages of pregnancy, in the sort of before 12 weeks, and although the RCOG advice and all the information that we've got has been very, very reassuring, some women have been more concerned because they know that the first 12 weeks is the time when the main structures of the baby are constructed. So quite a few have delayed until they've had their first scan. But the point that you made earlier about the interval between the first and the second injections, if you do wait until you've had your first scan, if you then have your second jab at after 56 days, you're still fortunately in the time before the third trimester, when the really big risks do seem to be kicking in, and I'm sure those, Andre, would reinforce the benefits of trying to get the second vaccination done before the later stages of pregnancy.
Yes, absolutely. Ensuring that you're double vaccinated before the later stages, but I do, because that's definitely the most risky time. However, I do have to say that we've had admissions at all stages of pregnancy. So the recommendation from us as obstetricians would be vaccinated as soon as you can be. And have said, because obviously if you're not vaccinated till 12, 13 weeks, and then you only have your second one at 18 to 20 weeks, you're actually spending half of your pregnancy unprotected.
And the evidence is really backing this up as well. We are fortunate that in America there was no advice about how to have it at any particular stage of pregnancy, and they were in a very bad way when the vaccination program kicked off, with really high transmission rates. So a lot of healthcare workers particularly chose to get vaccinated at whatever type of pregnancy, either before, in the first few weeks, first trimester, second trimester, third trimester. So we've actually got some quite good evidence of the safety, and it hasn't increased the risk of miscarriage. It hasn't caused, there's no evidence at all of it causing any problems in pregnancy being vaccinated. there, even at in the first trimester. But we have got a lot of evidence showing that you build up that immunity, and it does take a while to get going. So the sooner you get started, the sooner you get some immunity. It is up to personal choice, and at every vaccination centre, we have a GP who's going to be there. And actually, sometimes you'll also have a consultant gynecologist here, like Simon, who will be there, and fertility specialist who you'll be able to speak to. We also have quite a lot of midwives who work at the sites, and you will be able to speak to someone about this. And you'll be able to speak, have your own questions and get them answered on a one-to-one basis. So please do come down, come and have a chat with us, because we want to be able to answer any of those questions to enable you to get yourself vaccinated.
Great, thank you, Jen. So there's somebody who's raised a concern following on from the RCM's updated decision around they're concerned about the shortage of research on the developing fetus. So I just wondered if anybody wanted to touch on that.
Andrea, I'll let you go first.
So the recommendations are based on, as Jen was saying earlier on, about the data that's coming out of America, because those are large numbers of pregnant women that are being tracked throughout their pregnancy and afterwards, and there's been no signal of harm. These were women who were highly motivated to be vaccinated for the reasons just described, because there was high levels of circulating virus, well, a bit like it is in the UK at the moment, and obviously being frontline workers, they needed some protection. There was no opportunity to shield in the US, and therefore there was very high vaccine uptake amongst pregnant frontline workers. And so there's huge numbers, at least 130,000 that they're tracking through, more than that, I think, now that's been reported. And there's been no signal of harm at all. And the other thing to say is that actually, vaccine platforms are, as a result of many years of research. So all the components have been carefully researched, and so people think that these vaccines were just, developed overnight because it happened so quickly, but they were developed on the basis of years and years of vaccine development by firms that had, and research centres that had a lot of published research on all the various components. So they've looked at all that research base as well as the live data coming out of the US, and as there's no signal of harm, but there is a very high signal of harm for COVID, the recommendation is to be vaccinated.
That's great, thank you. So sorry, Jen, did you want to come in?
I just wanted to also talk about some of the other vaccinations that we routinely give in pregnancy. So we've been doing flu vaccinations in pregnancy for 10 years, I think. Routine, every pregnant woman is offered a flu vaccine. We know that vaccination in pregnancy is safe. We don't give certain types of vaccine in pregnancy if they're live vaccines, for example, because there isn't the evidence for those. But for these type of vaccines, like the COVID vaccine, like the flu vaccine, like the whooping cough vaccine, there is a lot of evidence that they are safe, and the harm that they prevent is really quite big. So, for example, the whooping cough vaccine, you have that one really not for your own immunity, but to really give excellent immunity to your unborn child through placental transfer, and also through breastfeeding as well. But it's through that placental transfer of antibodies. So it's not the vaccine going across, it's the antibodies going across. And that's why we do the whooping cough vaccine at a certain time, to really maximize this. Now, with the COVID vaccine, we are already seeing that babies are being born with immunity. And we know that vaccine, the immunity is being transferred rather than the vaccine itself. And we know that is the best that we can give our children by getting that vaccination, is to give them immunity that they cannot get other than by catching COVID themselves. There. So there is a very important bit in that we will not be vaccinating children routinely in this, definitely not our newborn babies. So this is the opportunity to give them some immunity that they would not be able to get otherwise.
Thank you. We've got a question here from someone who's currently 32 weeks pregnant, but their doctors haven't advised them to get the vaccination yet, but they feel like they should. Are they okay to get it at this stage of their pregnancy?
Absolutely, yes. I would recommend getting the vaccination as soon as possible.
Absolutely.
And I mean, obviously unsure as to where this lady's booked, but yes, and who gave her that advice, but the advice is very clear that to be vaccinated during pregnancy with the Pfizer vaccine, that's what's available locally. And we gave the information earlier on about how to access it, grabbing a jab, any of those centres. We also are hoping to improve the access in our antenatal clinics in the very near future, and we'll be vaccinating, offering vaccination with Pfizer more routinely during the antenatal clinic and during your visits, so you might be able to be vaccinated there. But as that's likely not to come on board, be available for a week or two, I would recommend you going to grab a jab as soon as you can.
And I would like, as a GP, I would also like to endorse this. I would advise every pregnant woman to get vaccinated. If there are pregnant women who have underlying health conditions, this means that COVID infection will make you a much higher risk of becoming seriously unwell for you and your baby. So it would be more important to get vaccinated rather than less. In fact, I can't think of any pregnant woman I would say, I don't think you should get vaccinated on a medical ground. There is enough evidence to show that this is safe. And I don't think that any of the consultant obstetricians or GPs should be saying that this is not advised for any woman. If you want to come and have that face-to-face conversation, if you do have an appointment with your midwife, you can talk to them. If you have an appointment with your obstetrician, you can talk to them. And if you want to speak to your GP, you can talk to them. And you can come down to one of the vaccination centres and talk to a GP there as well.
I think I should just point out that the advice did change on the 16th of April. So on the 16th of April, it was the recommendation changed from suggesting that people should strongly consider being vaccinated if they were pregnant and they were from a clinically vulnerable group. It changed to actually pregnant women should be vaccinated with their age cohort. And so although the RCOG and the RCM tried to get pregnant women to be able to access it as a priority, they were unsuccessful with their representations to the JCVI, the Joint Committee on Vaccination and Immunisation. So therefore, just with the age cohort. So that might be a little bit mixed messaging, because if you talked to your doctor before the 16th of April originally, that would have been, if you weren't in an at-risk group, they would have said, well, that you can't access it and it's not recommended at the current time. But it changed on the 16th of April. And the other thing to say is that the RCOG and RCM changed all their literature last week to strongly recommend that women are vaccinated during pregnancy, as opposed to strongly advising that you should think about it. Came up with a much stronger recommendation in view of the situation we're in at the moment, with the very high circulating virus and with the rapidly increasing admissions of pregnant women to hospital with COVID.
That's great, thank you. We've got a question that's come in around, can I have the second vaccination before the recommended 56 days?
So we're seeing a lot of people coming to our vaccination centres asking for their vaccination a little bit early, and we are unable to do that. The reason for that is that we know that the levels of immunity that we get are actually greater the further apart those vaccinations are. Now, with the, and we can see that actually when you look at Israel, where they vaccinated everyone at 3 weeks, which was the original design thing. And actually the immunity is not as good with Pfizer as it is when you spread it out 12 weeks. Now, there's not much of a difference between 12 and 8 weeks. So because of the high dose variants circulating, we've reduced that down to 8 weeks. But if we reduce it any more, we won't be giving you adequate immunization, adequate antibodies and immunity. So we need to keep that at 8 weeks. So unless there's a very good clinical reason, and that would be something like, I've got to go in for chemotherapy next week, or I have a scheduled operation, at which point you'll be given letters and things by your hospital consultant. Apart from that, we can't give those immunizations earlier for that reason, that we would not be giving you as good a deal as we would if we gave that vaccination from 8 weeks onwards.
That's great, thank you. Another question's coming around. I've had my first dose of AstraZeneca, but now pregnant. What second vaccine will I be offered?
So we're giving the people who've had the AstraZeneca first dose, AstraZeneca as a second dose. There is not any really high risk of the blood clotting disorder that there's been described with AstraZeneca on the second dose. We do know that the 2 doses of the same vaccine give really quite good immunity. We don't know how good combining different types of vaccine is. So what we are recommending is that women come in and get that second dose. I personally have had my AstraZeneca doses. I've had 2 of them there, and that second dose is safe there. And when we compare the risks of COVID to any of the risks that have been described, the risk of COVID is far exceeding any of the risks of getting a vaccine. And especially when you think that 1 dose of AstraZeneca will give you 33 or 1 in 3 chance of being fully immune, but 2 in 3 of not being properly immune.
Just like to make the point that actually we don't have concerns about AstraZeneca during pregnancy. Jen alluded to this earlier on. It's a very well researched platform for a vaccination. It's not really that novel, the AZ vaccination, so we're quite confident that it's safe during pregnancy. It's just that the big amount of data that we've got was from America, with the 130,000 women who'd all had Pfizer and Moderna. So on the basis of that, it was recommended Pfizer and Moderna. And then, of course, recommendation came out regarding the under 40s, regarding the rare complication of VIT, that VIT is thought to only occur with the first vaccination. And therefore, having your second vaccination should be entirely safe in pregnancy. That's our confident recommendation.
Thank you. We've had another question come in that says, I've had my vaccines, but they were only 6 weeks apart. Am I still fully protected?
So whilst you may not be quite as protected as if you'd had them at 8 weeks or between 8 and 12 weeks, we do consider that as a complete course. However, the booster program is going to be starting soon in September, and we're just going to pull in through all the information on how that will be offered. We do know that pregnant women, because they are offered a flu vaccine, will be in the cohort who are offered a booster vaccine. And that is looking like it will be a certain time frame away from after having that first 2 vaccines. Because what we want to do is build on that immunity and really get some really good sound immunity and give it to you when you need it. So if you're pregnant and you had your vaccinations, you had your first 2 vaccinations, then you can come and get your booster when it's your time, and more information on that will be coming. If you haven't had your vaccine and you become pregnant, we do know that some people are worrying about things, but then when they may become pregnant further down the line and say, oh gosh, I really should get my vaccines, we will start your vaccination program then, and you'll be able to have the 2 vaccines, your first and second. You wouldn't miss out on those. We would just start those rather than skipping straight to a booster. That's what we're calling our evergreen offer. But we'll have lots more information coming through about that over the next few weeks and months.
Great, thank you, Jen. That's all the questions that have been submitted today.
Fantastic. So I'd just like to take this moment to thank everyone for coming and watching, and thanking Andre, Simon, Natalie and Katie from helping today, so that we can give you a little bit more information about vaccination in pregnancy, breastfeeding, and whilst either trying to conceive or undergoing fertility treatments, and also a little bit of information on those menstrual problems that some people have been getting. If you do have any more questions, please get back in contact with us. And the information, we'll just pop it on the screen, in the chat there, so that you can know where to pop some questions through. We'll do our best to answer them and put them on the frequently asked questions slide that we're